Carolina is committed to you. We are going in depth tonight on a COVID-19 treatment the doctors say is becoming more widely available in hospitals and other healthcare systems throughout the Carolinas. They're called monoclonal antibody treatments, and they can save lives if used correctly. But in order to get the most benefit, doctors say you must get this treatment early. So tonight we are telling you more about what these treatments are, and we talked to an immunology expert. Our Matt Kaufax live at the Greenville County Health Department with more about this.
Tori, this is certainly something worth diving into a little deeper, but doctors I spoke to tell me first and foremost, your best defense against COVID-19 is the vaccine. However, if you do become infected, monoclonal antibodies, which you can get at most places in the upstate and around the Carolinas through doors like these now, could make the difference in your fight. Immunology expert Dr. Emmanuel Sarmiento says monoclonal antibody treatments for COVID-19 can be extremely effective.
It prevents death, it prevents hospitalization, almost 65 to 85%. That it reduces severe disease.
He says the treatment given via injection or IV works by blocking or fighting the spiked protein of the actual COVID-19 virus.
So it blocks the entry of the virus and it blocks the attachment to human cells, especially your lung cells.
But early treatment is key, as Dr. Mandy Cohen with North Carolina's Department of Health said during a press conference Wednesday.
The treatment must be given within 10 days of your first COVID symptoms.
Dr. Sarmiento says this is because by the time the virus is already replicated a lot, it doesn't work as well.
Don't do it when you're already hospitalized, your oxygen level, it's too late. A lot of these patients really may have mild to begin with, then it progresses rapidly to a severe disease.
He says the new Delta variant especially may just feel like bad allergies at first, which is why testing for COVID right away is incredibly important.
Get tested so that you could get treated early on and get better.
The sooner you know, the sooner you can get a treatment like monoclonal antibodies and have it work.
If you think you got it, you got to help limit the spread. So it's definitely important to get tested early for your own sake and for the communities.
Neighbors like Jacob Free say they definitely consider this method, especially if they or a loved one had COVID-19.
Anything to, help get over the virus. I know the remedies are few, but any of them are helpful.
To get this treatment, Dr. Sarmiento tells me that most of the time you just need to ask your doctor. Prisma Health, who I did speak to, and there are some others, they tell me that sometimes you do require a referral, but in most cases that is also relatively easy to get. And this treatment is becoming much more widely available. Prisma Health and DHEC also tell me that they have several infusion sites all throughout the upstate, so make sure you check on their websites to learn more. Back to you.